and gentlemen, and welcome to the Adult Quality Measures Macro State Submission Demonstration Conference Call. My name is Dan, and I'll be your operator for today. At this time, all participants are in a listen-only mode. Later, we will conduct a question and answer session, and if at any time you require operator assistance, please press *0, and an operator will be happy to assist you. I would now like to turn the conference over to your host for today, Laurel Holmquist. Please proceed.
Thanks, Dan. Good afternoon, everyone. My name is Laurel Holmquist, and I am with Truven Health Analytics, the education, training, and assistance contractor for the Macro system. On behalf of CMS's Division of Operations and Technical Services, we'd like to welcome you today to today's training, which is an in-system demonstration of Macpro's Adult Core Set Quality Measure Submission process. We're really pleased that you could join us. I'd now like to turn the floor over to Megan Thomas, the Adult Core Set Quality Measures business owner, to say a few words. Megan?
Great, thank you so much, Laurel. And good morning and good afternoon to all of you, depending on where you're joining from us today. My name is Megan Thomas. I'm the Technical Director in the Division of Quality and Health Outcomes here in CMCS. On behalf of CMCS, I want to welcome you to the Macpro in-system demonstration for the Adult Core Set Measures, and thank you for joining us today. Today's webinar will provide an overview of the Quality Measures Report submission process in Macpro, specifically focused on adult core set reporting, and will begin with a brief overview of the adult core set updates and technical assistance resources from our CMCS Quality Measures Technical Assistance and Analytic Support Program, followed by a live demonstration of the state submission process in Macpro. We look forward to introducing Macpro to you more fully in depth over the next few hours. So just one quick note before I turn things over to our primary presenter for today. We know that you're going to be presented with a lot of information during this session. Yes, the materials from today's session will be distributed to you shortly following the meeting, as well as some other resources to aid in reporting, both from a systems perspective and a measures content perspective, once the system is available for data entry later this month. You'll get that shortly. There's also going to be a little bit more information about these resources later on in this webinar. So with that, I'm now going to turn things over to the presenter for today's Adult Core Set Quality Measures Report and System Demonstration Training Session, Katie Lane.
Thank you, Megan. As Megan said, my name is Katie Lane, and I am also with Truven Health Analytics. As the operator told you, the call is on listen-only mode right now to prevent background noises. There will be an opportunity to ask questions throughout the presentation and at the end of the training as well. CMS and training personnel are here to assist with any questions you may have. Our agenda for today includes a presentation on technical assistance to support reporting on the adult core set quality measures for fiscal year 2015, a brief synopsis of what Macpro is and the quality measure roles available for states, an overview of creating, reviewing, and submitting an adult core set quality measure report, and a step-by-step in the system demonstration. The webinar will end with some information about how to contact the Macpro Help Desk, how to obtain technical assistance, next steps on getting started in Macpro, and a final opportunity to ask questions. To begin, we will pass the floor to the CMCS Quality Measures Technical Assistance and Analytics Support Program.
Thank you, Katie. This is Jessica Ross from Mathematica Policy Research, and I'm joined by my colleague Rosemary Bork. As Katie mentioned, we are part of the CMCS Core Set Technical Assistance team at Mathematica. I'm the Adult Core Set Measure Lead, while Rosemary leads outreach and activities related to data quality. Next slide, please. During this part of the presentation, we're going to review updates to the federal fiscal year 2015 Adult Core Set measures, discuss strategies for ensuring data quality, and end by providing details on where to find TA resources and answer any questions you may have. Next slide, please. So for federal fiscal year 2015 adult core set reporting, we have one new measure that was introduced, the Comprehensive Diabetes Care Hemoglobin A1C Poor Control Measure. At the same time, the Comprehensive Diabetes Care LDL Screening Measure was retired. Both of these measures are part of the HEDIS Comprehensive Diabetes Care Measure Suite, but the poor control measure looks at an outcome of diabetes care, and for this reason, the NQF Measure Application Partnership recommended adding it to the core set while retiring the LDL measure, which is a process measure. In addition, we wanted to call your attention to two enhancements of the Adult Core Set Resource Manual. First, we added more guidance throughout the manual and in Appendix B regarding how to determine sample sizes for measures that can be calculated using the hybrid method. And second, we also added a new appendix that clearly defines various types of practitioners to help clarify the intent of the measure specifications. And this can be found in Appendix D. Finally, there were also a number of additional, more minor changes, and these are all detailed in the Summary of Updates to the Adult Core Set document, which is located online at the link shown in this slide. Next slide, please. And now I'll turn things over to my colleague Rosemary Bork, who will discuss the process we use to review data submitted for the Adult Core Set and best practices for ensuring data is complete and accurate.
Hi everyone, it's Rosemary Bork, and we appreciate the opportunity to talk with you today about CMS's data quality efforts for 2015. Next slide, please. So to recap 2014, starting with the 2014 Adult Core Set, CMS implemented a systematic state outreach process where the TA team and CMS reviewed each state's data as they were submitted in cards, and then the TA team followed up with states to follow up and clarify any questions or concerns about the Adult Core Set data as they were reported in cards. So on this slide, you can see some of the most common types of questions you might have received in the outreach in 2014. First were questions about potential data entry or calculation errors. So for example, if we reviewed the data and found that the numerator and denominator were inconsistent with the rate that was reported, we would follow up to clarify about that. Other examples would be additional clarification on unexpected or unclear values in key data fields or notes. And these were cases often where CMS needed a little more information to understand what the state was conveying so that it could be make sure that we were reporting it correctly in public reporting. So for example, if your state reported that it used an other population, but the notes didn't exactly specify who was included or excluded from that population, that's something we would follow up about. Similarly, if the rate field was entered as 0 or left blank and there were no accompanying notes to explain that value, we would have also followed up to clarify that. And then finally, some of you may have received questions about changes in your state's reporting from the previous year, from 2013. And this is mostly focused on notable increases or declines in a denominator or a rate for a measure. And this is first to just confirm that the reporting is accurate, and also because CMS is very interested in learning more about states' challenges and their progress in these quality areas, and also about how Medicaid population and program changes may affect your rates. And it's on the slide, but we contacted I think every state that reported Adult Core Set data, and every state wrote back in a timely, collegial manner and provided really critical information for public reporting. So we want to say thank you to everyone for your participation last year. Next slide, please. So this process will occur again for the 2015 Adult Core Set, but this slide describes some of the changes that will occur this year. And first, there will be some changes because MacPro already contains some built-in data quality checks to facilitate data completeness, data accuracy, data consistency, and data documentation. And just to note that some of the upcoming slides in our portion of the presentation will highlight some of these data checks and some of the changes in MacPro. And you'll see some new data fields and new data sections. We don't expect you to be familiar with these at this point. Just know that there will be an in-system demonstration of MacPro after our section, and we hope that these slides can be a resource to you as you start reporting. In addition to changing the system, CMS has identified some additional areas of focus for the 2015 data quality outreach, and these areas were based on areas of inconsistency in previous years, as well as communication and feedback from states on areas where they'd like additional technical assistance support. And you'll see some examples in upcoming slides, but just briefly, we'll talk about reporting rates that were developed using the hybrid method, reporting of delivery systems in your state, and reporting of the start and end date fields. Finally, last year you would have received an email from the TA mailbox with any questions about your core set data. This year, all of the communication will be integrated with MacPro's Seek More Information functionality. And again, this is something that our MacPro presenters will show you later in the presentation. So the rest of our slides focus on some reporting tips for each of the key components of data quality, being data completeness, data accuracy, consistency, and documentation. And these tips were developed based on the state outreach from 2014, updates for macro reporting system, and again, also from feedback from states. And we are going to provide some examples in the slides, but it's a lot of information, and some of it is fairly dense. So just know that we're planning to go through at a fairly high level. I'll probably be talking pretty quickly, trying to get it all in, but we hope that you can use these slides and all of the TA resources we highlight as you begin reporting. And of course, you can always email the TA mailbox with any questions. Next slide, please. Okay, data completeness, reporting tips. The goal would be for every state to be able to report all rates for all populations for every measure that they're reporting. And as your state plans for 2015 reporting, we just ask that you please review whether all populations are included, whether all rates are being reported. But understanding that in some cases, measure-eligible enrollees cannot be included. And in those cases, we ask that if you know that a group is excluded from the measure-eligible population, that you please note that in the additional notes and comments section in MacPro. Ideally, if you have the information available, it'd be nice to know the size of that population, and if you have any reasons or explanations for why that population couldn't be included, that's also really useful feedback for CMS. And examples of missing populations could be things like missing delivery systems, such as fee-for-service or managed care, or even within a delivery service. So, for example, if you have data from 2 of your 4 managed care plans, but 2 are missing, that's really useful information. In addition to missing populations, you may find that you're unable to report a rate for a measure, and in those cases, you'll see that in MacPro, there are separate places to enter numerator, denominator rate for each rate, and if you do not have that information for a rate, we ask that you leave those fields blank rather than zero filling, and there's an associated text box with that rate. We just ask that you explain to CMS why that rate is unavailable. Next slide, please. Okay, this is one of the first of our really dense slides. So just as an overview, this slide is describing how states can report for measures that were calculated using the hybrid method in MacPro. And states have contacted CMS and contacted TAT with challenges of reporting state-level numerators and denominators for these measures in the past, particularly for states that are combining data across multiple reporting units, such as multiple health plans. So the table in this slide describes some of what we've deemed the essential information about your state's rate, the total sample size, the measure-eligible population, and information about the reporting units that are included. And the second column indicates the field you can use in MacPro to report that information. So you'll see some of these are new fields. There is a what is the sample size field, what is the measure eligible population field, and this will probably make a little more sense once you see MacPro, but we hope that this table can help states report this, and you can always follow up with us, but this would be the goal for reporting, is to report the state level rate, the measure eligible population, and information about the reporting units that are included. Now, this is sometimes this information can be a little confusing in the abstract. We've provided an example in an appendix to this slide that goes through with mock data for a state that has 3 health plans, how they would report a hybrid rate in MacPro. So we won't go through that in our presentation today, but there is an appendix slide that some of you may find useful once you start reporting. Next slide, please. Okay, the next point we'd like to cover is delivery system data fields. These have been reported in different ways by states in the past, And there's also a little change in MacPro. So in MacPro, there are two different places your state will report on its delivery systems. So first, there's for each measure, and this is similar to what it was in CARDS, for each measure, your state will report all the delivery systems in your state that serve the measure eligible population, and then the percentage of that delivery system that's included in the data. And then if you include managed care enrollees, we would want to see the number of managed care plans that are included. So the table has a couple of examples from state A and state B showing how the state could fill out the fields in MacPro depending on the delivery systems. Both this example, you can see that in state B, the state uses fee-for-service and managed care to serve this population. All of the fee-for-service enrollees are included, so the state would report 100%. However, none of the managed care enrollees are included, so state would still want to select managed care and then enter 0%. In addition to these fields for every measure, there's a new section on the administration page of MacPro where the state is asked to fill in the delivery systems that serve the total Medicaid adult population. And this slide is where you can provide CMS with a little context about your overall delivery system serving your adult population. Next slide. Okay, data accuracy and data consistency. So first, just want to let everyone know that reporting rates will be a little bit different in MacPro than it was in CARDS. So for measures that were based on administrative data only, MacPro will automatically calculate the rate based on the numerator and the denominator that you report. So we encourage states to check these auto-calculated rates. You will not be able to manually enter a rate. So we just ask you to check that the rate that is auto-calculated by the system is consistent with what you would have reported yourself. And then for measures that are based on hybrid or, for example, a mix of hybrid and admin, states will still manually calculate and report rates. So those measures won't change, but the admin data only measures, it will auto-calculate a rate for you. And then a couple of other notes about data accuracy. You know, we understand that data entry errors can be very easy to make. There's a lot of data fields to enter. And examples of some of the things that we talked to states about last year were transpose numbers, missing numbers, and reporting in the wrong data field. So for example, the follow-up after hospitalization measure has a 7-day rate and a 30-day rate. And there were cases, for example, where the 30-day data were entered in the 7-day rate and vice versa. So this one tip is just to ask someone in your state who is not filled out the data to review the data you've entered. In particular, this can be helpful if the person entering the data in MacPro is not the person who developed the data. So asking other staff members to QA before you finalize your state's report. Another area where sometimes there are questions is when data and notes are inconsistent within and across measures. So within a measure, for example, the follow-up after hospitalization measure, you'd expect the 7-day and the 30-day rate denominators to be the same. So when there are cases where the denominators differ, it may suggest either a data entry error or potentially a calculation error. So the data, there's also supporting all this, and a lot of these checks, these specific examples I'm giving, come from a data quality checklist. And this has been updated for the 2015 adult core set. It will provide a link to it at the end, and you can get access to it on the CMS website. But there are a lot of checks like that just to look through before reporting that can catch some of the most common data entry errors that we've seen. And lastly, just a plug to contact the staff in your state who report the child core set, because we encourage states to work within across core sets, and there are measures that are reported in both core sets. Next slide. Okay, finally, data documentation. We understand, and CMS understands, that there are many reasons state may need to add in additional context or provide information about how they approached a measure slightly differently. And we just ask that if your state deviated from any aspect of the core set specifications, that you would explain that and report it in the deviations from measurement specification section. And for each deviation, please just describe how exactly your state's methods differed from the core set specifications. So for example, if your state did not use specified service codes to identify services for the numerator, you would select that there was a numerator deviation and then describe how your state calculated the numerator services, including, for example, use of different codes, and how that differed from the specifications. And finally, one other tip is to compare your state's data with data reported for federal fiscal year 2014 and look into any large changes. One, this can be a good way to confirm that reporting is correct, and also because it can be helpful to CMS to understand more about changes in your state. Finally, just as you're checking, just be aware that in some cases specifications can change slightly, which would make rates for 2014 not comparable to 2015 rates and not necessarily indicative of a change or a problem. If you are trying to do this, just note that historical data is not currently available in MacPro. States may still access their data for 2014 adult core set in CARTS though. Next slide. We wanted to focus a little bit on the start and end date fields. As you all know, these measures have very complex reporting and time periods, and they may differ for the denominator, the numerator, the continuous enrollment period. And states have reported these inconsistently in the past, and it's been challenging for CMS to determine exactly what time periods are covered in each state's rates and how it varies across states. So for starting with the 2015 adult core set, we ask that states report the measurement period used to calculate the denominator in the start and end date fields. For many measures in the adult core set, this corresponds to calendar year 2014. There are measures that require your state to, once you've identified your population, to then look back and review utilization and enrollment prior to this period. But states should not include those prior review periods, also called look-back periods, in the start and end date fields. And again, if there's any deviations from the measurement period for the denominator or numerator, we ask that you note that in the additional notes and comments section. Next slide. We won't go through this example in detail, but this example is an example of a measure, the AMN measure, that has a denominator period with also a prior review period, and gives an example of how a state that followed the core set specifications would fill out the start and end date field. And you'll also see a link here to a measurement period table. This is a new technical assistance resource on CMS website that defines the denominator, numerator, and continuous enrollment period for each core set measure. Next slide. Okay, I'm now going to pass it back to Jessica Ross to describe the TA resources that CMS is providing to support state reporting.
Thanks, Rosemary. So we've reviewed a lot of information in these slides, and recognizing that it's a lot to remember, we wanted to be sure everyone was aware of the multiple technical assistance resources that are available on CMS's Medicaid.gov website. Next slide, please. Okay, there's a ton of links on this slide, obviously. This slide basically contains links to all the adult core set TA resources that are currently posted on Medicaid.gov. You can see the first one is a link to the Adult Resource Manual. The second is the summary of changes that I mentioned at the beginning of the presentation. Next is the data quality checklist that Rosemary talked about, which lists helpful tips for ensuring measures are being reported accurately. We also have a frequently asked questions document, which provides answers to common questions that come up both about the measure specifications and how to report the data. And new this year that Rosemary was just talking about is the measurement period table, which is designed to help ensure that start and end dates are being reported consistently and it's clear which data periods are reflected in the measures being reported. Finally, we have the MacPro template for the adult core set, and the last link here is the general link to the adult core set webpage where additional TA resources will be posted. So I know that's a lot of information, but all the links are here for accessing later as needed. Next slide, please. And finally, we encourage states to reach out to us with questions that arise regarding the reporting of the adult core set for TA related to the measure specifications, such as how to calculate, report, or use the measures. Please contact CMS at the macqualityTA@cms.hhs.gov email address. And then for assistance on how to use MacPro, the contact is macpro_helpdesk@cms.hhs.gov, as you see here. Next slide, please. So at this point, we'd like to ask the operator to open up the phone lines for any questions related to anything either Rosemary or I have presented.